Hey guys, just giving y'all an update. It's been 1 week since my surgery and I'm getting a lot better. I'm still really kind of sore in my shoulder and it's really tight. It feels like if you put a t-shirt on wrong and it got twisted around your arm and you're trying to raise your arm up and you can't. That's what it feels like. It feels like something is keeping your arm from moving. And it's swollen. They ended up taking, I think, 14 lymph nodes. And so they were digging up in my arm, getting those out. So it's very swollen. It's numb, but I can feel it at the same time, which is weird. I am getting phantom pains and phantom itching, which is, I mean, I knew that it could happen. I just have never experienced it, obviously. So it's just a very strange sensation to feel pain in a breast that you don't have anymore. So, but overall, I've been doing okay. I'm only really taking pain medicine at night. I'm taking Advil during the day, mainly because of the anti-inflammatory process with it. I'm trying to ice after I do any exercises because I want that swelling to really go down, and then if it's cramping later on, I'll put heat on it, but not for long. So if you do have surgery, just remember you don't put ice on it for more than 20 minutes at a time. After that, the blood flow stops and your healing stops, so you don't want to do that. Another thing that I want people to know if they have to have a mastectomy is that you have to keep moving your arm or it will get so tight that you won't be able to move it. I've seen people talk about this on Facebook telling people, you know, don't move your arm as much. Don't do your exercises because you'll have more drainage in your drain tube and then they won't take it out. I'm like, yeah, but then you're going to have frozen shoulder from that. So you've got to move your arm around and get that blood flow going. And I started mine the day after. It's 24 hours after surgery, just because I was afraid of getting it, losing so much range of motion. And the first day that I did it, I could maybe get my arm up to about here, but now I can get up there, but feel it all kind of popping. So I can't go as far back as I normally can, so that's one thing I'm working on. But doing that and then being able to do this, and it's sore, but the thing that bothers me the most is all the weird popping that I feel. And some of that may be the drain, because I can feel it under my skin. I can tell when it's pulling fluid into it because it vibrates. It's a very weird feeling. Let me see, what else was I going to tell you? So I talked about range of motion, the drains. So luckily I only have one drain. And I'm so happy because this has hurt more than anything else. So this is my drain. You may have heard it called a JP drain. So it almost needs to be filled. But this goes in right about here. It's stitched in. I'm allergic to adhesive. So I had gone without anything on it, but it kept getting pulled around so much that I got a whole bunch of skin prep. And I'll show you what that is later, but it's a barrier that you put on your skin. We first started using it with ostomy patients. So it's like a little alcohol wipe, except it's got liquid that gets sticky, but it forms a barrier of your skin between that and the adhesive. So I was able to put some tape on it to help keep it from moving around so much. But basically I'm just pinning it to the bottom of my shirt. I have had a fanny pack that I put it in at times, but I got tired of that thing, so I may use that if I go out, if I ever get to go out, which I don't think is going to be until next week when I go to the doctor's office. So, but hopefully I'll be able to get this out next week when I go for my follow-up. I think it has to be below a certain amount of cc's in 24 hours, and I can't remember what it is. He didn't tell me, so I'm thinking it's less than 10 or 20 cc's in one day. And right now I'm getting about 100 out. So hopefully that's going to slow down as the inflammation goes away, and I'll be able to get this thing out because it hurts more than anything else. The incision doesn't really hurt. it's sore. It feels like you've worked out or you've hit your muscle on something and you have that soreness afterwards. So, but yeah, oh, and I have pizza on my shirt. So, you can tell that I am in my comfy clothes. So anyways, I wanted to show y'all how I put my pillows on the bed so that if you ever have to do this, and this isn't just for mastectomy, if you have shoulder surgery or you have any kind of chest, breast, anything, this will help you with your sleeping. So I'm going to show you that. So this is the bed that I sleep in. Yes, I sleep upstairs. My husband talks a lot and snores and hits things in his sleep, and I'm a very light sleeper, so I don't sleep with him in the same bed anymore because I value my comfort and my sleep. So this is a wedge. We actually got it from when my husband was in the hospital for an appendectomy. So you put that down first, right up against the back. Then you get a little, just a regular standard pillow. Put it right there. And next thing is if you have one of those pregnancy pillows, I've got it just because it helps me sleep at night, helps me get in the right position. But you can either get a C-shape or a U-shape one. They're not expensive anymore like they used to be. You put that right up there, and then I just kind of flip that over. And then I'll put this down so I can get in bed. And then you put one pillow on each side, and you put a big pillow in the middle. And then once you sit down, you pull this up, and then you've got your supports under your arms. So I slept on this the first 3 or 4 days like this. And since I usually get on the other side, but since all this has happened, I have found a way to get into the bed without hurting. So I think this comes from my dancing, but y'all won't have these sides to the bed like I have because this is a Murphy bed. But this is how I do it. So I just swing my leg in and sit down. I don't ever have to use this arm. So then you just pull this up. You can also pull this in front of you and put your legs on top of it, under your knees if you want. And then you just sit back. You can elevate this more, and it's totally comfortable. I totally fell asleep like this and did not have any problems at all. It was great. So, and then this is the table that I built. It's kind of like the IKEA one that slides over your bed. So I made this because I can just pull it up. Got my laptop. I can eat on it if I want to, but I really haven't been eating on it much just because I'm trying to be active. So I don't sit around and get tight. So that's pretty much it for today. If y'all have any questions, let me know. I wanted to make sure you're aware of the website that you can go to learn more about my particular type of cancer. It is called inflammatory breast cancer, and the website is theibcnetwork.org. I'll put it below this in the comments. Oh, I did get my pathology back today. That's one thing I was going to tell y'all. So they didn't find any active cancer in my breast. They found where the cancer had been, that the chemo had gotten to. So that's a good sign. And then they found more precancerous areas. Ugh. So that was good. Out of the 14 lymph nodes that they took, they found cancer in 2 of them. Said that sometimes it gets picked up on the scan, sometimes it doesn't. So it's just because of this disease and the way that it spreads out. It's not in one clump like traditional cancer tumors are. So, but they got it all out, and I'll do radiation next. I think it's 6 weeks is what they said they were wanting me to do. I don't know. I'll have to find out exactly what that's going to be when I follow up with my oncologist in a couple weeks. So that's good news so far. As you can tell, I'm still working on getting my endurance up, and just getting into bed makes me out of breath. So I hope everybody's doing well. Please tell everybody to wear masks that you see that's not wearing one, because this COVID thing is real. I'm a nurse. I'm telling you it's real. And I have friends that are working in hospitals that are, even in Memphis, are fully overflowing. In fact, the only reason I was able to have surgery was because I was planning on going home the same day. They canceled all the other surgeries in front of me because they didn't have a room to go to. They were completely full. So please wear your mask, and please pass it on. And I hope everybody enjoys their holidays. I don't know if I'll get to post again before Thanksgiving, but I'll try, and I'll let y'all know any updates. And y'all have a good one. Talk to you later. Bye.